Auzubillahi Minash-Shaytanir-Rajeem. Bismillahir-Rahmanir-Rahim. I hope you people are doing well, and I am here again with a new scenario for medical students about ophthalmology. Today we will talk about amblyopia. Amblyopia is defined as a lazy eye and decreased in the vision without any organic eye disease. This is the definition of amblyopia. Before I start the scenario, I must clarify that many of us confuse it with refractive errors. It is not a refractive error. Refractive errors are myopia, hypermetropia, astigmatism. These three are refractive errors. Aphakia is not an refractive error. It is absence of lens. Presbyopia is not a refractive error. It is age-related decrease in the near vision. And myopia and amblyopia, these are two different words. Amblyopia is a consequence and myopia is a refractive error. So if a scenario comes like this, for example, a 25-year-old male comes in IOPD with the complaint of sudden loss of vision in right eye for the last 1 day. On examination, his vision in the affected eye is 6/60 and in the other eye it is 6/6. On further examination in the affected eye, it was found that he was having +2 diopter spherical of hypermetropia, and in the normal eye he had no refractive error. So in this scenario, the clue is that there is refractive error in the one eye, and that is hypermetropia. And usually in hypermetropia, amblyopia is more common, and you can say the thing which you can confuse you is histories of only 1 day. This is a thing to understand, because most of the people do not realize that they have decreased vision in one eye, because they have never seen with one eye at a time, that is by closing one eye and seeing by other. And incidentally, sometime when they close one eye and they realize that their vision in one of the eyes is much decreased as compared to the others, so they tell to the doctor that the vision was alright, just it got worse just 1 or 2 days back. In reality, they have never checked it before, so that's why they usually give a short history. But many people know it from the very beginning, and they tell you that this eye is weak for the last many years. Now, what are the possible stems? Number 1, name the probable diagnosis, which is amblyopia, and list 3 causes of amblyopia. So amblyopia is basically because of deprivation of image or sensory stimulus. So it and the connection between the optic nerve and visual pathways to lateral body to the visual cortex are not made in the early years of life. So sensory deprivation can be because of many causes, and the three main causes are congenital cataract in one eye, hypermetropia, even plus one diopter of hypermetropia may cause amblyopia or high myopia in one eye, and squint, divergent or convergent in one eye. Amblyopia usually common in one eye, but it can occur in both eyes. For example, uncorrected hypermetropia or bilateral ptosis in the children. So these are a few causes, and there are other causes also. Anisometropic, as we have discussed, and because of astigmatism also. The third step can be name the treatment option. The treatment option is before the age of 11 years, you have to patch the better eye and ask the patient according to his age to do the near work like coloring the color books, see the mobiles with the affected eye with the correction of the refractive error for a few weeks, and in as young as the patient is, the prognosis is good, and after 11 years the prognosis becomes very becomes guarded. So early detection of amblyopia is very important while you are screening the patient in OPD. So I will close here. Hope to see you with some new scenario from examination point of view. I hope you get some informative information which you might be wanting, and please write in the comment box what you want to hear about and what you want to know. For now, thank you very much. Allah Hafiz.